how to manage menopausal syndrome. How can you manage the signs and symptoms of menopause? All that we taught in our last video, the signs that you are undergoing menopausal process, menopausal syndrome, and the various signs, we discuss it. Now, how can you manage them to be healthy, to be more comfortable, to be strong, to support yourself, to cope with life? How can you cope with menopausal syndrome? It is important to take note that once the cause of a problem is known, it is easy for management because you will manage according to the causes. Remember, we said in another video that the ovaries may not be functioning well. The follicles might completely be finished. The secretion of hormones like estrogens may drastically reduce. Then the body of man, the body of that woman suffers withdrawal of hormone. Now that the lady had reached puberty at an early age, maybe 12, 13, 14, and she has been on puberty and very reproductively active throughout until at a certain age, she now reached menopause. Her body had been used to increase levels of estrogen, and at the moment it drops. At the moment it increases. At the moment it drops. And your body has been so adapted to that and coping with it. At the time estrogen level will not be able to rise again, your body will still suffer the loss of the estrogen. The fact that estrogen levels begin to dwindle and reduce, your body suffers estrogen withdrawal. And those signs I will discuss present. How can you manage them? 1, hormone therapy. 2, non-hormonal therapy or treatment. We are going to discuss these 2 ways. You can use hormones to manage menopausal syndrome, but you could still use other means without hormone. That's non-hormonal treatment. Let me start with the hormonal treatment. What kind of hormone can a woman take to cool down the effect, to reduce the signs and symptoms of menopause? Those very hot ones, especially like hot flushes, moments of heat, sweating, and then moments of cold, then a lot of vaginal dryness, discomfort that may bring you cracks and wounds in the course of sexual intercourse. A lot of those signs, sleeplessness, what we call insomnia, how can you minimize them? Now that we know that all of these signs are coming as a result of the withdrawal of estrogen from your system, then they can use synthetic estrogen. They can supply estrogen as hormone to your system. So the first hormone is low dose estrogen therapy, where they will give you estrogens. I still plead, please go see your doctor. Your doctors are trained on this and they can manage it better. And because they will control it at levels that you can cope with it without exaggeration of signs, without much discomfort. Then another one is hormone combination, combined therapy. There is only estrogen progesterone combination, and they can give it. This can be well managed by your health experts. So you don't do them on your own. Go to hospital and know that what they are going to do on you, you already even understand it. So your mind is already settled, and when you come back, have some peace, and you may lie down and catch some sleep. Now, non-hormonal therapy. Non-hormonal therapy or treatment. Example is diet. Diet is food. What you eat supplies the elements that drastically reduce in your system. At this moment, with withdrawal of estrogen and this upset of changes, your body needs to have all what it needs. Food nutrients, all from carbohydrates, proteins, mineral salts, fats and oils, anything, vitamins. All food nutrients are important at this time. We always will emphasize on increased levels of fruits, vegetables. I say fruits, vegetables, fluids. Fluids are something that has water, something that is watery. They might be a juice, fruit juice. You people might know how to make them and drink. And then even water, you normally drink a lot of water. No, don't remain dehydrated and never go dehydrated. Things will be worse. So you drink a lot. Your diet is going to do a lot. Stay away from caffeine. Anything that has caffeine in it. Reduce spices. In fact, if there's a way to stay away from spicy kind of foods at this level, greatly better. So, diet-related issues, manage them well, and you are going to cope until you completely go through the menopausal changes. Number 2, exercise. You must be active, be doing something that keeps your blood circulating, that keeps your blood active, that promotes blood circulation. Exercises are very good, and exercises are of different types. We do not expect you to wake up some kind of vigorous exercise as if it's a young lady. You can gently walk. Okay, you can get up one morning and take like 30 minutes just to walk to somewhere, walk back and do some exercises. Sometimes house chores are tedious in a way that they already cover the place of exercise. Do you do them? When you wake up in the morning, do you clean your house? Do you clean your dishes? Do you clean your pots? Do you cook your food? Do you wash your dresses? Do you make your bed? Do you try to go to the farm? Do you work farm? Do you go and carry some load from the farm and come back to the house? Do you, and so on, a lot of activities. They are good. These our ladies, our mothers, our sisters, especially in farm areas, in those areas that go and work farm and they concentrate a lot on their farms, especially in our villages. A lot of them remain active and strong and can cope with this process better than those who live sedentary life, that better than those who are, they say they are living in the coast, they are living outside, some feel that they are rich and they have this or other and they become very soft and they refer to most of you like a jebo people. Their own suffering, their own signs become more exaggerated and the discomfort is more serious. Number 3, you join support groups. There are support groups these days everywhere, organizations that you join other women and they share their experiences and what they do to feel better, and that is how you cope. Number 4, prescription drugs. There are certain drugs, they fall under non-hormonal because we are not talking about hormone. About hormone, even though among some of the drugs, you also have what we call birth control pills. But apart from birth control pills, you have antidepressants. A lady going through that easily can get depressed. So the one that is getting depressed can use they can prescribe antidepressants to the person. And then birth control pills, as I said, then estrogen sometimes is prescribed in the form of gel and you apply, some in the form of pills, some in the form of creams. Yes, let your doctor manage this for you. If the signs you are going through as a bit more exaggerated and bring a lot of discomfort, meet your doctor. There's always a way to minimize the signs, yet you will cope to go through that process until you are fully at menopause and these signs greatly reduce and you can start coping better again. There are certain risk factors, especially when we are talking about managing menopause. What are some of these risk factors? There are risk factors to what? To hormonal treatment. Because these hormones, sometimes we also advise, if a woman can understand this and struggle to cope by other means and avoid the hormones that your system has been working with it maybe since you were 12 years to you are now 50 something, and then that hormone is gradually withdrawn and you're suffering, that if you can cope with it without bringing in the hormones again, better, because these hormones also have their own risk factors, which I would like to remind us. For example, endometrial cancer can be common. Gallbladder stones can be common. Blood clots can be common. Deep vein thrombosis can be common. Okay? Pulmonary embolism can be dangerous. They can be common. Stroke is also common. These are risks that you face if you begin to depend on hormones. That is a reason why we say depend on your doctors, because they can regulate it at levels, taking into consideration that you could have complications of this. Ladies and gentlemen, if you so love this lesson and you love our teachings on reproductive health, please subscribe, like, and share. You can make your comments. You can write even on WhatsApp by the numbers 674-605469. If you are out of Cameroon, add or start with +237. Then you add the number. But you can go to the comment section, make your contributions. I will even plead that you can propose a topic for us to teach you. You may be going through some problem as far as it relates to reproductive health. Please propose topics to us to teach you. Join our community for some support. Maybe a cup of tea from a well-wisher may be greatly appreciated. In fact, will always be appreciated. And abundant blessings will follow. Thank you. Thank you.